Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Next, we have locally advanced breast cancer. In the locally advanced breast cancer, we have stage 3A, stage 3B, and stage 3C are involved. So, locally advanced breast cancer, first you can do neoadjuvant chemotherapy is indicated with modified radical mastectomy with an adjuvant radiotherapy. Then breast conservative surgery. We can do a breast conservative surgery is done for 3A and also 3A tumor with N1. In them you can do a breast conservative surgery. It gives and it is done in patients with good response to neoadjuvant chemotherapy, because after doing this breast conservative surgery we should have neoadjuvant chemotherapy should be done. So in those patients where neoadjuvant chemotherapy can give good results, in them we can even do breast conservative surgery, but better to do modified radical mastectomy with neoadjuvant chemotherapy with adjuvant radiotherapy is best done. Then we have systemic chemotherapy can be done with radiotherapy can be done. So, systemic chemotherapy with radiotherapy is also indicated. If there is grossly involved internal mammary nodes, if there is internal mammary nodes are involved, then we can do this systemic chemotherapy with radiotherapy can also be done. Then, if there is distant metastasis, what do you do? Now, if there is distant metastasis that is in stage 4, here already there is distant metastasis, so the aims of the treatment is to prolong the survival and to improve the quality of life. So the main aim is to prolong the survival and improve the quality of life. So here mainly the hormonal therapies are preferred in these patients. The hormonal therapies are preferred to cytotoxic therapy, and these hormonal therapies are mainly associated with minimal toxicity.
thank you and thank you for watching.